How do you interpret Pap smear results for next steps? Interpreting Pap smear results can seem complicated, but understanding the categories helps you know what comes next. The main system used is called the Bethesda system, which sorts results into clear groups. If your Pap smear shows -4 intraepithelial lesion or malignancy, it means no signs of precancer or cancer were found. Your cervix looks normal, though sometimes there might be benign issues like inflammation or infections such as yeast or herpes. If this is the case, your healthcare provider will recommend routine screening, which usually happens every 3 to 5 years depending on your age and the type of test used. If the results show epithelial cell abnormalities, it indicates some changes in cervical cells, often linked to human papillomavirus infection, which is the main cause of cervical cancer. These abnormalities are categorized into different groups. For example, if your results say atypical squamous cells of undetermined significance, or ASCUS, it means there are slight cell changes that often relate to HPV but may resolve on their own. The next step is usually reflex HPV testing. If the HPV test is positive, your doctor might suggest a colposcopy, which is a detailed examination of your cervix. If the HPV test is negative, your provider might recommend returning to routine screening. If your results show low-grade squamous intraepithelial lesion, or LSIL, it suggests mild abnormalities often caused by HPV. These changes often clear up naturally, so your doctor may suggest repeating the Pap test and HPV test in about a year or sometimes doing a colposcopy depending on your age and risk factors. For more serious abnormalities like high-grade squamous intraepithelial lesion, or HSIL, the risk of progressing to cancer is higher. In this case, your healthcare provider will likely recommend an immediate colposcopy and biopsy to assess the extent of the abnormality and determine if treatment is needed. Sometimes, results show atypical glandular cells, or AGC, which can indicate precancerous or cancerous changes in the cervix or uterus. These findings usually requiring a colposcopy with endocervical sampling, and sometimes an endometrial biopsy, to get a clearer picture. Occasionally, Pap smears detect infections or benign conditions that may need treatment but do not necessarily mean there is a cancer risk. In addition to the Pap smear, human papillomavirus testing is often done at the same time. If your HPV test is negative, it generally means your risk of cervical cancer is low, and you can wait longer before your next screening, often up to 5 years if you are over 30. If the HPV test is positive, especially for high-risk types, it indicates a higher risk, and your doctor will likely recommend closer follow-up, such as repeat testing or a colposcopy. Screening intervals depend on your age and results. For women aged 21 to 29, a Pap smear every 3 years is typical if results are normal. For women aged 30 to 65, you might have a Pap test every 3 years or co-testing with HPV every 5 years if both tests are negative. If your results are abnormal, more frequent monitoring or diagnostic procedures are usually necessary. To sum up, if your Pap smear is normal, you continue routine screening. If there are minor changes like ASCUS, your provider will check HPV status and decide whether to observe or proceed with further testing. For more significant abnormalities like HSIL or AGC, immediate colposcopy and biopsy are recommended. Remember, these guidelines are designed to catch precancerous changes early, which greatly improves treatment success. Always follow your healthcare provider's advice, as they will personalize the next steps based on your individual risk factors and medical history. Understanding your results helps you stay proactive about your reproductive health and cervical cancer prevention.